Have you ever heard of any condition called frozen shoulder before? Well, frozen shoulder is a very serious health condition. It is also termed as adhesive capsulitis. Frozen shoulder is a condition that is being characterized by stiffness, limited mobility, and pain in the shoulder joint. Okay, so it is actually a condition that affects everyday activities due to its symptoms that it comes with. So it affects everyday activities and then also impacts your quality of life as well. Okay, now someone may ask, what are the causes of this condition? I'm sure you are waiting, right? So let's dive in. So now the very first cause has to do with injury or trauma to the shoulder can cause this condition to set in. The second one has to do with inflammation. That one can also cause this. That is, inflammation has cardinal signs such as pain, loss of function, yes, redness, increase in temperature. Maybe there is an injury over there, inflammation is taking place. So as a result, there is stiffness in the shoulders due to immobility. You are at a high risk of developing frozen shoulder as a condition. The very third cause is autoimmune disorders such as diabetes, and then thyroid conditions can also cause this. The next cause has to do with prolonged immobility. If you are not performing movements with your shoulders, it can also result into that. And then the last cause has to do with aging, old age, most especially with peak incidence of between 40 to 60 years. Yes, so that is for the causes. Now, let's move into the risk factors. What are some of the risk factors that predispose you to this condition? The very first one has to do with diabetes as a systemic condition, can also predispose you to this condition. The next one has to do with thyroid conditions, which is also a systematic condition. Then we also have trauma. That is when you have been involved in an injury. You are also liable of having this condition. And then trauma or surgery, to be precise. And then the next one has to do with previous shoulder injuries, can also lead to that frozen shoulder as a condition. And then the last one is sedentary lifestyle, inactive lifestyle, also leads to this condition. All right, so let me send you through some of the symptoms that you may experience when you have this condition. I'm going to give you 3 symptoms, and the first one has to do with, the first symptom is painful shoulder stiffness. The next one has to do with limited movement in the shoulders. It can be the left or the right, or even both. Yes, so there will be a limited range of motion in the shoulders, or the shoulder, being it the left or the right. All right, and then so there is limited movement in the shoulder, being it left or the right. And then the last one has to do with pain at night, making it difficult for you to sleep. So it disrupts your sleep, or it disrupts your quality sleep that you were having before. So now, as I said, I'm a student physiotherapist, and then whenever I make a video and then I don't talk about physiotherapy, then I don't think the video is going to end. You understand? Alright, so sure, we have physiotherapy management for this condition, and they are as follows. I'm going to give you 4 physiotherapy management tips that are being used in treating this condition by the therapist. This is just a gist. So the very first one, or first problem we want to look at as physios, is pain management, which is very, very, very key. Then that one, we use some modalities and then specific individualized exercises for you, the patient, in order to relieve you of your pain and also make sure there is movement taking place in the shoulders since it has been limited. And then the second thing that we are looking at is to give you prescribed range of motion exercises, that is movement-based exercises, to also enable adequate movement within the shoulders. and then the shoulder joint, to be precise. And then the third thing that we are looking at is mobilization techniques. We apply mobilization techniques, which is joint mobilization and then soft tissue release, so as to enable adequate activities of the muscles surrounding the bones. Yeah. And then the very last thing that we will be looking at is to make sure we correct posture and also educate you, the patient, on the condition. We will actually educate you, the patient, on the condition first before we even correct your posture. Isn't that beautiful? It is, right? Let's get in. So now I'll be sending you through some importance of early interventions. Okay. Now, so early physiotherapy intervention significantly improves outcomes, which in turn reduces pain, restoring mobility, and then preventing chronicity. And then you see, the more chronic the condition is, the more serious it becomes. All right. So we want to prevent that. You get me? Now, let's move. So now, in conclusion, it is a treatable condition. This frozen shoulder condition is a treatable one. And don't ignore the signs and the symptoms that I made mention of earlier. The symptoms, never ignore them and then never take them lightly. But rather, seek professional advices from a PT, that is a physiotherapist, to regain shoulder function and then quality of life. Okay, don't forget to adhere to these important protocols and then advices. Remember, I love you all, and I'm here to raise awareness of physiotherapy and then making sure that you live healthy. This brings me to the end of the video. Thanks for watching. Don't forget to subscribe, like, comment, and share. See you next time in the next video. Bye.